To my friends and colleagues in Romania, and in particular in the Ministry of Health and the newly elected Ministry of Health of Romania, who recently, on March 14, 2018, signed the pledge to Clean Care is Safer Care program and the Save Lives, Clean Your Hands campaign to promote hand hygiene nationally and to improve patient safety. In particular, also to Dr. Andrea Moldovan, who was so energetic and visionary to make sure hospitals in Romania would adhere to better hand hygiene and infection control program in the country. Hello everyone, and welcome back to this special annual day, the 5th of May. This year, the WHO Global Hand Hygiene Campaign celebrates its 10th anniversary since it started in 2009. Many thanks to those of you who participated in this campaign for many years, and welcome to the newcomers. Thank you for your dedication to hand hygiene and infection prevention and control to prevent avoidable infections and improve patient safety. Every 5th of May, WHO promotes hand hygiene in healthcare, calls health facilities to register to the WHO Save Lives, Clean Your Hands campaigns, and urges various groups of healthcare professionals to take concrete actions to transform the campaign messages into best hand hygiene practices. This year, WHO targets sepsis in healthcare through the promotion of hand hygiene and infection prevention and control best practices. So, Benedetta, can you say why sepsis is linked to the campaign this year? In fact, why sepsis?
Thank you, Didier. Sepsis arises when the body's response to infection injures its own tissues and organs. If not recognized early and managed promptly, it can lead to septic shock, multiple organ failure, and death. At the 7th World Health Assembly in May 2017, Member States adopted a resolution on sepsis entitled Improving the Prevention, Diagnosis, and Clinical Management of Sepsis. The resolution requests WHO to support Member States in their strategies to reduce the incidence of mortality and long-term complications from sepsis. Member States are urged to increase public awareness and to include sepsis prevention and appropriate and timely diagnosis and treatment in national health system strengthening actions. Sepsis is a global public health problem. WHO, as well as all of us, need to act on it. The WHO Global Hand Hygiene Campaign is a perfect opportunity for us to join efforts and to show our commitment to fight sepsis with a focus on its prevention in healthcare.
Thanks, Benedetta. Well, it's clear that strengthening infection prevention and control programs and promoting hand hygiene are critical actions to prevent sepsis in healthcare. Conrad, is sepsis a global health problem? So in other words, why is sepsis so important in the global health agenda?
Sepsis is estimated to affect more than 30 million people every year worldwide, potentially leading to 6 million deaths each year. About 1 in 10 maternal deaths is due to sepsis. Sepsis kills up to 500,000 newborns every year. Thus, sepsis is a serious threat to global health. Unfortunately, sepsis affects more in health settings where resources are limited. It also affects more vulnerable people such as the young, the elderly, and those with multiple comorbidities. Every infection can potentially lead to sepsis. Sepsis is not observed in critical care only. Sepsis can occur anywhere in communities as well as in any hospital ward. We must overcome sepsis by improving its prevention, diagnosis and clinical management as stated in the resolution.
Thanks, Conrad. Thank you very much. So, what do you think would be the first steps to reach what would be called a world free of sepsis? What is the vision of the Global Sepsis Alliance?
Indeed, the vision of the Global Sepsis Alliance is a world free of sepsis. Each health worker needs to know that sepsis is a common health problem. We need to raise awareness of sepsis worldwide, even among all health workers. Early recognition of sepsis is very important to avoid evolution to life-threatening conditions. Patients and families can play an important role in this process, and therefore they have to be informed and educated. Several countries have taken strong actions and achieved important national results in terms of public awareness and sepsis reduction.
Thanks, Conrad. Thanks for sharing your thoughts. There is no doubt that sepsis could result from community-onset diseases as well as from everyday patient care practices by health workers. In all healthcare settings around the world, hand hygiene is key to best infection prevention and control practices. We and others have proven that improving hand hygiene dramatically reduces infections and saves lives. Benedetta, how can the WHO Global Hand Hygiene Campaign specifically address this need?
Yes, thank you, Didier. Promoting hand hygiene through the WHO multimodal strategy strongly contributes to effective infection control, both at facility and national level. The pathway of sepsis prevention consists of two key steps: prevention of infection and prevention of progression to sepsis from infection. Hand hygiene is a critical action for the prevention of infections that may lead to sepsis. Thus, the 2018 WHO Global Hand Hygiene Campaign slogan is "It's in your hands, prevent sepsis in healthcare."
Thank you, Benedetta, for making it very clear why the WHO campaign this year is addressing preventing sepsis in healthcare. Each of us has a role to play to prevent sepsis in our facilities and globally. Health workers, take 5 moments to clean your hands to prevent sepsis in healthcare. Infection prevention and control leaders, be a champion or be champions in promoting hand hygiene to prevent sepsis in healthcare. Health facility leaders, prevent sepsis in healthcare. Make hand hygiene a quality indicator in your hospital. Ministries of Health, implement the 2017 World Health Assembly Sepsis Resolution. Make hand hygiene a national marker of healthcare quality. Patients and patient advocacy groups, ask for 5 moments of clean hands to prevent sepsis in healthcare.
WHO urges health workers, infection prevention and control leaders, health facility leaders, ministries of health, and patient advocacy groups to demonstrate your commitment and dedication. To support your action, we have developed a range of new advocacy, training, and technical tools and resources that help all of us better understand how to prevent sepsis and implement infection prevention and control programs in healthcare.
It's in your hands. Prevent sepsis in healthcare. Let's work together. Get the board. You know this famous board, Conrad?
Yes.
Take a pen and go on. Sign it in the name of sepsis people preventing sepsis.
With pleasure, Didier.
Thank you, Conrad. And of course, Benedetta will do the same.
Thank you, Didier.
Let's join hands.
Let's promote hand hygiene together.
Let's prevent sepsis.
It's in our hands. We wish you all a great success and excellent 5th of May 2018.
Let's save lives together.